She fell asleep in my truck on the way home. This was right after Rihanna's Shine Bright, or Diamond. Yeah, Shine Bright Like a Diamond, where that song had come out. And I love that song just because of this ride, because it came on the radio like 3 times in the hour and a half drive back to Augusta. We got back to my apartment and went upstairs, and I'd already bought a ring at this point. And we went in my apartment, and she just like dropped her stuff, like took off jacket and pants and just crawled in bed and just fell down, and I crawled in bed too, and then I jumped up and ran and opened up my gun locker, and it's not gun safe gun locker, so lots of clanging and loud noise because it's just sheet metal, so very, very loud, very, very obvious I was getting something. And then I run back in there, and I'm trying to hide this little ring box from Jared, and I opened it up, and I said, "Now will you marry me?" And she said yes.
Shine bright tonight, you and I, we're beautiful like diamonds in the sky. According to Webster's dictionary, transgender means a person whose gender identity differs from the sex the person had or was identified as having at birth. And according to the Williams Institute, in the United States, 0.6% of adults are transgender. That may seem like a small percentage, but that is actually 1.4 million Americans. In Texas alone, 0.66% of people identify as transgender, which, once again, is not a small percentage. That's 125,000 people. This population size is approximately the same amount of residents in Abilene, Texas. With such a large population identifying as transgender, we wanted to know how their issues in general and in healthcare are being addressed. Going to the restroom may seem like a simple everyday thing for cisgender people. But wait, we have to consider that for transgender people, this may not always be such a simple task, which was a major topic of interest in the documentary that we all watched, Growing Up Coy. The conflict in the documentary is centered around the issue of going to the restroom. The documentary focuses on a Colorado family with 5 children. One of the children, Coy, is a trans female. She was born a boy, but her parents described how ever since she could talk, she obviously preferred being a girl. Her parents recognized Coy's opinions and allowed her to transition from boy to girl in the middle of her kindergarten year. As a girl, she wants to use the girls' restroom like all the other girls in her school. However, her teachers and principals forced her to use the boys' restroom due to the genitals that she was born with. The use of the boys' restroom led to Coy being bullied and abused. Coy's parents did not agree with what the teachers and principals decided, so they chose to file a complaint against them. The complaint was based around Colorado's anti-discriminatory law. This law states that someone cannot be discriminated against based on their race, gender, or sexual orientation, including others. In doing our research about the transgender culture, we had the opportunity to interview the spouse of a transgender woman. We first asked, what types of positive interactions have you had with healthcare providers?
So most of the time, healthcare providers, just given the, I would say, the emotional component of their interaction with their patients and their customers, they're generally a lot more empathetic than most other professions. So they seem to be really understanding when they interact with patients. Like, okay, hey, even if maybe they do, disagree with transgender people, which is a stupid concept, but whatever. Even if that's like a thing, then they still realize that a positive customer and patient interaction is going to net them the best experience and the best results possible.
We then asked, what unique experiences related to healthcare have you and your wife had?
As far as transition-related medical treatments, most of those, actually all of those, are still technically not permitted under TRICARE, which is the military's health insurance, and under most federal and state government health insurances. There are a significant number of exceptions to that, but by and large, that's generally the answer. I know with the military, hormone replacement therapy in and of itself is not prohibited. It's just prohibited as a transition-related treatment. So if you can find a doctor that's willing to bend the rules a little bit and articulate it the right way, is something that can be prescribed and covered under that military health care. Otherwise, as we're doing right now, you have to pay out of pocket for it.
The combination of spironolactone and estradiol is commonly seen as a hormone replacement therapy regimen for a transgender female. Counseling points you may focus on for spironolactone include polyuria, polydipsia, and orthostasis. Additionally, estradiol may require you to counsel patients on headache, weight gain, abdominal pain, and the black box warnings of increased risk of breast cancer and cardiovascular disease. In a survey of 63 PGY1 community pharmacy residents, only 36% of respondents stated that they feel confident in their ability to treat transgender patients. This greatly implies that there is a gap in the curriculum of pharmacy students where they are not fully informed on transgender culture. Percentage-wise, the transgender population may seem small, but they are not insignificant. When counseling a person undergoing something like hormone replacement therapy, it is important to make sure that you're treating them just as anyone else. They deserve the same level of respect as any other cisgender patient that you may encounter. I, so alive. We're beautiful like diamonds in the sky. Shine bright like a diamond.